Hey there, I'm Dr. Kyle Loveless, and I'm shooting this video real quick on back pain. I've had a lot of patients in the last probably 3 or 4 weeks asking me about friends of theirs that have back problems and how chiropractic can help with it. More importantly, helping explain that to their friend, how chiropractic is better than medicine for back pain, even better than physical therapy for back pain. And we know that it is from the research. Actually, chiropractic is the only thing in treatment-wise so far that has been proven to actually beat the placebo in the research. Physical therapy hasn't done that. Pain meds can't do that. And we know that there's an epidemic of pain meds. The number one thing you're going to get when you go to your doctor with back pain is either a muscle relaxer, a pain med, or a steroid shot. And none of those do anything to fix the cause of your problem. They actually make your problem worse. Steroid shots weaken the tendons and ligaments. Muscle relaxers actually stop your muscles from spasming, and your muscles are there to protect you because you have a spinal problem, and they spasm to help support you. It's actually a good thing, even though it hurts. And then pain meds, obviously you're just getting rid of the pain when your body's telling you there's a problem, okay? So the biggest thing to understand about back pain is that there's a problem in your body or in your spine that's causing the nerves that cause pain to be impinged, causing pain. And so there's an actual problem there. By covering it up, you're just making the problem worse. And you might take a med and it might go away. You might take an ibuprofen, but these things have side effects and it's not going to fix the problem, meaning a year from now, 2 years from now, 3 years from now, you're going to be worse. And that's not the way to go, because eventually it might get to the point where there is nothing left but surgery. So it's super important to do something about your health now when it comes to back pain. Typically what I've found is that once you feel the pain, unless you just had a major accident like a car accident or injury, when this pain just comes about slowly, it typically means the problem has been there for a long time. It really does. And typically patients will come in, they say, my back started hurting about 2 weeks ago. We take an x-ray, we find arthritis, degeneration, which means it takes 10, 15 years for that to develop. And it's just now showing up as pain. Okay, so it's usually a bigger problem than you think. So I'm going to dive into real quick how back pain happens and then how you can get help with it through what we do, which is chiropractic care, rather than something like physical therapy or of course, which is way worse, pain meds, muscle relaxers, steroid shots, surgeries, things that don't work, okay? So here's the deal. So when you look at the spine, and this is really important to understand, and my spine's, I try to get this thing as straight as possible, but the key is, in the back especially, you need to have a curve from the side, and it needs to be straight from the front, okay? Now you have your spinal cord that goes right in the middle through these vertebrae. You have all these vertebrae here, and these bones are made to protect your spinal cord, but they're also meant for movement, right? And you should be able to move. Outside of these bones comes nerves, and these nerves branch off to the organs. They also branch off and they go to your muscles, okay? When you're having pain, what that tells us is that these joints in your back are either fixated, not moving, or they're specifically out of alignment, called a subluxation. That puts pressure on the nerves, and if you're feeling pain, it means it's hitting nerves that cause pain. What I want you to understand, though, is it doesn't have to just be nerves that cause pain, okay? I'm gonna pull this picture up real quick so you can kind of get the concept of what I mean by that when it comes to how the body works. So if you look at this picture right here, okay, over here, let me just see if I can get this lined up. Okay, so right in the center, so you can see the brain right here sends signal down the spinal cord, that goes out nerves. And in your lower back, those nerves go to your digestive system. So a major problem you'll see with back problems over time is digestive issues like constipation, diarrhea, Crohn's, issues like that. It goes to the female and male organs, so you can see things like ED, menstrual cycle issues, cramps. Those nerves also, which you don't see on this picture, but they go down your legs. So you can see sciatic nerve issues, cramping in the legs, restless leg syndrome. All those stem from that lower back. So you see the back pain is actually just your body saying there's a problem. The bigger problem is there's pressure on the nerves, which can affect organs, okay? And you can see from this picture, it really does relate directly to those symptoms. Okay, so you can see this lower back, pretty much from this part down, T12 is to your small intestines. You're going to see things like rheumatism, gas pains, digestive issues. Large intestines is L5, so colitis, diarrhea. L2 is things like cramps, varicose veins, leg pain. L3, menstrual cycle pains, miscarriages, impotency, knee pain. L4 is back pain, difficulty, painful, or frequent urination. L5 is back pain, leg pain, constipation. Sacrum is sacroiliac conditions, back pain, hip pain. Coccyx, the far bottom part, goes to hemorrhoids. These are no joke, right? So these all go to these symptoms, and again, your body has a problem there. So to correct this, number one, you have to have the proper examination and evaluation, and then the proper x-rays to diagnose it, okay? What I mean by that, by proper, meaning we need to look for subluxation, which is when your vertebrae don't move, okay? So you have these two vertebrae here, where you have this nerve coming out. Well, these vertebrae need to be able to move. When they lock in place, it puts pressure on the nerve. So when we evaluate in that consult and exam, we're going through and I'm feeling, and I can actually find the areas that aren't moving, and that can tell me where the problem is. At the same time, we'll take x-rays with you leaning to one side, leaning to the other side, and looking straight forward, and then x-ray from the side, and that x-ray will tell us exactly where the problem is, and it'll tell us if you have disc problems, it'll tell us if you have a degenerated spine. It can also tell us if it's just subluxated and it's an easy fix, okay? But that's the key. You have to find out first by the proper evaluation, the proper x-rays. After that, it's about correcting it. And the way we correct that with chiropractic is we adjust the spine. It's very light. It's not scary like you might think with chiropractic. We adjust the spine, and that movement into your spine relieves pressure off the nervous system, and the pain starts to go away. And that can take time. They've said it's anywhere from 6 to 12 visits to get rid of back pain. And it can be more than that if it's severe and been there a while. But it takes time. But when that pressure is off the nerves, your body now can start to heal. Because the key is your body was made to heal. All these organs are attached to the spine and the nervous system. And as long as that system is working, your body is healing. Okay, so the first step, find the cause. We start to adjust, get pressure off the nerves, and your body heals. And then after that, now we start to retrain the system so the problem doesn't keep coming back. Okay, because your body's built a muscle memory. Right? That spine, when you lose the curves here, if you've lost the curves in your back, or your pelvis is rotated, it's trained to be that way. We have to literally retrain all the muscle in here so that it holds and stays that way, so you don't one day have a disc problem or one day have to have surgery. Okay? We have multiple